All right, let's dive right into this explainer. Today, we're demystifying Down syndrome, also known as trisomy 21. But look, we aren't just going to sit here and list off a bunch of dry clinical facts. Instead, we're taking a really fascinating journey. We're going to literally start by zooming way in on the microscopic genetic level, then look closely at the human body and how it develops, and finally, we'll expand our view all the way out to society at large. It's a complete micro to macro look at what this condition truly means.
To start us off on the right foot, we absolutely have to tackle this one critical question. Is Down syndrome a disease? Well, the answer is no, absolutely not. It is not an illness, it's not some disease you can catch, and it's certainly not something to be cured. It is fundamentally a genetic condition that's present from the very moment of conception and obviously evident right at birth. It simply means an individual has a totally unique genetic makeup. Now, you might be wondering, why is making that distinction so vital? Because framing it as a disease, that just creates unnecessary stigma and fear. But understanding it as a natural genetic variation, that completely shifts how society perceives it, moving us toward real acceptance and support.
Okay, moving to Section 1, the microscopic reality. Let's start at the very beginning. We're zooming all the way in on human genetics and our chromosomes to figure out exactly how this condition happens. The main mechanism here is something called non-disjunction. So during early cell division, the chromosomes just fail to separate properly. Think of it kind of like a zipper on your jacket where one tiny tooth catches and the two sides just won't pull apart. It's a completely random genetic event that ends up resulting in an extra copy of chromosome 21. And I really want to emphasize this right out of the gate. Parents do not cause this through anything they did or didn't do before or during pregnancy. It is entirely 100% random.
Now, we usually talk about Down syndrome as if it's just one single thing, right? But there are actually three distinct types. Full trisomy 21 makes up a massive 95% of cases. That means the extra chromosome is present in absolutely every single cell in the body. Then we have Robertsonian translocation, which is about 4%, where part of chromosome 21 actually attaches itself to another chromosome. And finally, a tiny 1% is mosaic Down syndrome. It's literally like a beautiful mosaic piece of art. Only some of the cells have that extra chromosome while others don't. And because of that, clinical features can actually be highly variable depending on exactly which cells are affected.
Let's move on to Section 2, Screening and Diagnosis.
Now that we've got the underlying genetics down, let's look at how healthcare professionals actually detect the condition, often before a baby is even born. There is a really stark contrast here between screening tests and diagnostic tests. It's a distinction that honestly confuses a lot of people, but it is incredibly important. Prenatal screening, things like first trimester combined tests, cell-free fetal DNA, or standard ultrasounds, these only evaluate the risk or the probability of a baby having trisomy 21. They can't give you a definitive answer. Diagnostic tests, on the other hand, like chorionic villus sampling or amniocentesis, actually pull the DNA directly to confirm the diagnosis with absolute certainty. For expectant parents who are naturally managing a lot of anxiety, knowing the difference between risk and certainty is absolutely crucial for making clear-headed decisions.
Of course, not all cases are caught prenatally. If it wasn't detected during pregnancy, a postnatal diagnosis kicks into gear right after birth. Doctors will do a physical exam first, looking for specific characteristic features. But a physical exam isn't enough on its own. To get that official genetic confirmation, they'll run a chromosome analysis, called a karyotype, using a simple blood test. Karyotyping is actually super fascinating. It literally creates a visual map of the baby's chromosomes. Doctors can look directly at this map, visually count the extra 21st chromosome, and confirm the diagnosis for sure.
All right, zooming out a bit. Section 3, the physical picture and medical realities.
So, moving out from the DNA to the whole body, let's talk about the physical traits. While individuals might have unique features like upward slanting eyes or a single palmar crease on their hand, I really want to focus on this one foundational characteristic: hypotonia. Take a newborn with hypotonia, for example. This means they have low muscle tone. It's why a baby might feel a bit floppy when you pick them up, and it frequently leads to joint hypermobility. This one physical characteristic is exactly why they might have a slight delay in physical milestones, like sitting up or learning to walk, when you compare them to typical development charts. And this low muscle tone is precisely why the targeted therapies we'll be talking about next are just so incredibly important.
But, it's not just about muscle tone. That extra chromosome can actually impact multiple systems throughout the whole body. For instance, looking at the cardiac system, atrioventricular septal defects are pretty common, and they might even require surgery early on. The endocrine system often needs to be monitored for hypothyroidism, and there can definitely be gastrointestinal or neurological impacts too. Now, none of these are absolutely guaranteed to happen to everyone, but simply knowing the risks, that is a total game changer. It allows for proactive, life-saving care. Routine, specialized screening for these specific conditions is absolutely essential to make sure individuals stay healthy and really thrive throughout their entire lives.
Which perfectly sets up Section 4, Therapy and Development.
Let's get into the practical side of care. Because there's no cure for a genetic condition, and remember, we don't cure genetics, we support the person, this 3-step multidisciplinary rehab approach is the absolute gold standard. Step 1 is physiotherapy. This directly combats that hypotonia we just talked about. It builds up muscle strength and balance so a child can successfully learn to walk. Step 2 is occupational therapy. This is all about refining fine motor skills for everyday life. Think of things like figuring out how to button a shirt independently or just holding a spoon securely. And step 3 is speech and language therapy. This goes way beyond just talking. It actually helps build the specific mouth muscles needed for a newborn to nurse properly, and then later on it helps with articulation and expressing themselves. Together, all this early intervention helps children reach their absolute maximum potential.
Zooming out even further now to Section 5, Education and Adult Life.
Looking at things on a societal level, modern care and inclusion have just dramatically transformed what life looks like for someone with Down syndrome today. Just walk through this life course trajectory with me. Following the clinical milestones, you can clearly see the compounding effect of all that early care. A proper diagnosis and cardiac evaluation at birth leads right into active therapies by age 2. By school age, those exact therapies empower the child to jump right into inclusive education, using individualized education programs. And that translates directly into a young adult who successfully transitions into vocational training, independent living, and active, meaningful participation in their community. We really have to pause here, because this trajectory is a massive modern triumph. Decades ago, this timeline looked drastically different, often ending in heartbreaking institutionalization. Life expectancy and overall quality of life have skyrocketed, and it's precisely because of modern medicine and real social inclusion.
And that brings us to our final part, Section 6, Myths, Facts, and the Future.
For this final section, we really need to clear the air. We've got to address some incredibly harmful misconceptions. When we put these common myths directly up against evidence-based facts, the truth is just so powerful. We can definitively strike down the idea that the parents are at fault. We know now it's a completely random chromosomal event. Zero truth to the blame game. We also see that the whole myth of universally severe intellectual disability is totally false. Abilities are highly variable, and they are massively improved by that early intervention we discussed. And finally, that outdated, tragic notion that individuals with Down syndrome can't work or live fulfilling lives, simply wrong. Today, so many attend school, hold down meaningful jobs, and are active, deeply loved members of their communities.
To support folks and live in those fulfilling lives, major health organizations all over the world, like the WHO, the CDC, and the American Academy of Pediatrics, have laid out some strict, incredible guidelines. Their focus is completely on proactive care. We're talking early diagnosis, routine screening of the heart, vision, hearing, and thyroid, and of course, early multidisciplinary intervention. This right here is a brilliant blueprint for lifelong family-centered medical follow-up. It ensures that people with Down syndrome don't just survive, but that they have every single opportunity to live robust, incredibly healthy lives.
Which brings us to the very end of our explainer. I really want to leave you with this final, powerful thought. Down syndrome is a genetic condition, not a disease. Every single individual has unique abilities, unique strengths, and just incredible potential. We've zoomed out today from the microscopic non-disjunction of one single chromosome all the way out to the community level. So I'll leave you with this question. Knowing what you know right now about the massive impact of early intervention and just how false those old, harmful myths are, how can you use this knowledge to help build a more inclusive, supportive society starting today?